Hi, good evening, everyone. 2025 was a year where Indian healthcare confronted its digital realities. AI moved from concept to workflow, ADM integration actually accelerated, and hospitals began modernizing core systems. But the year also exposed a lot of gaps, such as we have data silos, we have legacy complexities, and of course talent shortages, and of course we want to basically scale up responsibly. you know as we step into 2026, organizations need to actually have a clearer priorities and a stronger execution plan, with a shift from pilots to having enterprise level outcomes. I welcome one and all to this digital health DHN Digital Health Town Hall 2026. Today we have five, eminent CIOs of leading organizations in healthcare participating. This conversation is not all about tools, but actually we will be talking about transformation, and we'll discuss what will truly move the needle. What has truly moved the needle in 2025, and what has held us back, and what we should basically be focusing on in the coming year. I am joined by five of these eminent CIOs of our nation. Firstly, we have Mr. Saji Matthew, who is CTO of Baby Memorial Hospital. Good evening, Saji.
Good evening.
Uh, Mr. Manish Kumar is the CDO of Adani Healthcare. Good evening, Manish. Uh, Mr. Sudeep Dev, CIO and CISO of ABDM, also is with us. Ms. Pooja Chatrat,
Good
CIO
evening,
of
everyone.
Onquest. Good evening, sir. And
Good evening,
Ms. Pooja
everyone.
Chatrat, CIO of Onquest Laboratories. And I think Mr. Lakshman Sharma, CIO of Sarvodaya Healthcare, will be with us also very soon. I think he is also joined now. Good evening,
Yeah,
Lakshman.
good evening, everyone. Good evening, everyone. So
Yes.
please excuse me. I'm driving right now. I'm joining from my car. So I'll mute myself. Whenever you ask me question, I'll unmute myself that time.
Fair enough. Sounds good.
Yeah.
So with that, let's get started. And with that, I would like to call upon Mr. Manish Kumar, as I said, from Adani. And, as you may know, Adani is a new entrant in healthcare, and he has a great advantage of designing his IT infrastructure from scratch. And, he does not have any legacy to worry about. And I would like to ask him, how has he been, architecting his, digital vision for Adani? And how are you basically approaching interoperability, ABDM readiness, cloud systems, and of course NABH standards that have become quite important and relevant? So Manish, some thoughts on that, please.
Hope all of you can hear me.
Yes, absolutely, loud and clear. Manish, do you want me to recap the question again? Was it audible? Should we come back to you, Manish? Are you able to hear me? Uh,
Can I? Can you hear me all? I'm so
yes, we can
sorry.
hear you.
I
Yes,
can't
we can hear
hear.
you. We can hear you. Let's do one thing. Manish, maybe we can solve your audio problems in a second, and I'll come back right to you after your, this audio issue is maybe solved, and I'll just move on to my next guest. if that is okay. Okay, I'll let me do that and I'll come back to you, Manish. Okay. So I will actually then go to Saji. And Saji, Baby Memorial has been, adopting, digital health standards, digital systems for a long time, and you actually were one of the foremost or earliest, ones who got this digital certification done. So, what level where you basically, you went for, and further, how do you think that has changed your approach, since then, how it has, influenced, your IT roadmap and your interactions and decisions related to vendors, Sajid?
Okay, good evening to all of you. Thank you for having me this evening with you. The NABH digital health standard has benefited in multiple ways. One, in terms of benchmarking myself or our hospitals against the rest of the hospitals in India, in terms of our digital maturity. We were one of the initial adopters of DHS standard. We went for the gold standard at that time when looking at some of the excellence objectives that were a bit hard work, needed additional investment. So we are very honest and assessed ourselves. And the DHS current framework allows, like when you do your initial assessment, you need to score 60 on certain days apart from your core objectives, other one. And subsequently, when you go for your surveillance, only need 80% scoring on that one. And have clarity in terms of the investment. So we thought, okay, it is better to go for gold, and we applied for gold. But subsequently, when the internal assessment and subsequent assessment happened, we were close to the platinum scoring. But this is the beginning. Now, even the standard, the accreditation, the duration also it's changed from 2 years to 4 years. Initially, it was for 2 years. We thought, okay, when we go for the reaccreditation, or so we will be able to change it to a platinum category. But this, in terms of the benefit, that point in time, we were like looking for investors. So now the entire Baby Memorial Hospital platform was a PE investor. So when the PE investors came and assessed ourselves in terms of our digital capabilities, this definitely was a help in terms of where we stand. And recently we were looking at across the platform, single centralized HIS for us, the EMR HIS. So again, here the NABH EMR HIS standard was very helpful in terms of identifying the vendor. So two ways. One, the vendors who are already certified for that one, and also it gives a set of standards which you can easily use in your RFP and benchmarking various HIS EMR players in the market. So that is another benefit of adopting or looking at the NABH DHS standard. Then between the hospitals also, it is now we have a benchmarking mechanism. So in terms of the NABH digital health standard, where we stand each of the units, that also is another way of benchmarking and looking at the investment or in terms of the looking at or measuring the assessing our digital maturity. Definitely now the new investments or the IT investments are definitely one, aiming at reaching from where which level we stand to a next level. Definitely we want to be in the top tier cream layer. So that is definitely our investments are also driven towards that one, but definitely with the aligned to the business objective. So now we, as a platform, looking at centralizing, moving to a lot of shared services, which is enabled by technology. So this compliances or adherence to standard also is a equal given consideration. So when we were working on our recently, we were working with one of the big four, drafting out our 5-year IT strategy and roadmap. All these points were considered along with EDP, recent DPDP requirements also being considered, and these are being put into the roadmap. So that way, the adoption of a digital health standard definitely helps in terms of improving, creating visibility within the organization, seeking your management support in terms of investment, and creating visibility to external stakeholders, and creating benchmark or making meaningful comparison between various units in terms of digital health adoption. So it helps, really benefits the hospitals. And again, now the NABH had uh, various programs rolled out, digital Mitra programs, then digital Yatra programs to bring the entire Bharat into the digital mainstream. So a lot of hospitals in tier 2, tier 3 cities needs a hand holding from NABH or corporate hospital who have gone for this digital health adoption to bring them into the benefits of digital health adoption.
Thank you very much, Saji, and many congratulations for having done this, one of the pioneers in this field. Manish, I want to come back to you if your audio problems are solved, if you can hear us. We were definitely able to hear you. Okay, we will basically move on to our next guest. Sudeep Dev, you are from Aster. And I want to ask you one question, okay, with regards to EMR. You
Yes.
see, basically, in our context, the Indian context, the HIS and EMR are, still by and large, basically, are looked at for appointments and billing and things like that. Whereas, there are so many other modules, that can enhance, first of all, a better EMR, and then of course utilization of that, right? So what I wanted to basically, ask you, what is your, current status of EMR adoption, specifically for clinical documentation and decision support, and what's driving or blocking deeper clinical engagement? Sudeep, any thoughts on that, please?
Yeah, thank you. Good evening, and thank you for asking that question. EMR in our organization, both the current and the previous one, has been the central piece, and more so because the clinicians themselves are also understanding the importance of structured data when they want to publish something and the turnaround times are higher with data which is not captured digitally. If it is not captured digitally in a chronological manner, they are also facing the challenges. So at an apex level, I would say that everybody and anybody who is in clinical administration in my organization here and in the previous one were fostering it. But then there are some realities which are there on ground, and we have been targeting EMR right at the core. For example, just to highlight, not just at OP level is still simpler, but there is a lot of communication between the clinician and the patient there. But in IP also, so I will answer in both terms. In OP, we are trying to experiment with ways wherein they don't have to look at the screen and type, or only some critical. There are, if you look at the OP part, there are four critical items which happen. One is you will either recommend medicines or recommend a diagnostic test or recommend a referral, go see another doctor, or you will say get admitted on this date. So these are the four things which we are wanting the doctor to prescribe and fill it through his entry point. When I say entry point, I don't want him to type it out. Currently, in my organization, they are typing it out, but we are looking at options where you can speak and it can be taken down, or you can at least scribble it on a notepad and get it done. Uh, the impetus, as I said, from the organization is very high. And as we all know, I think most of us are a for profit organization, and there is no qualms in saying so. Even for the organization administratively, it is good to have that data. You know how we can engage with the patient for his betterment and for the organization's betterment. Now on the IP side, the discharge summary is the key document which is important. Of course, as you said, uh, every aspect of IP, a 5-day stay in a hospital is not just a 5-day stay, and at the end of it you create some documentation. Every day there is a documentation which is getting filled up by the clinicians who are treating or checking the patient. So for that, what we are trying to do is we are trying to streamline, harmonize, and make sure that there is minimalistic data entry points which are required. Now coming to the um, we have three parameters which are like lead indicators to see how EMR is performing, and by and large the graph has been Without the initiatives, the graph has been relatively stable, and with an increment of 5 to 10% month on month is what is happening. But the larger thing is the EMRs which we have planned cannot be planned as any other regular solution. If we are fostering patient care which is continued with EMR, then the EMR has to be available, because we will be doing away with normal pen and paper records. So for that, the EMR system being reliable, be available during the patient hours, which is 24 by 7 in my hospitals here. In the previous one, it was not so 24 cross 7 because we were treating a chronic disease. We are very focused on making sure that this is safeguarded, and at the same time the disaster recovery and BCP options are also worked upon. So that assurance we have given to the doctor. One assurance needed by the doctor is that I should not lose my patient connect. The other assurance sought by the doctors is, what if God forbid the system fails? So my effort at the moment technically is more on making sure that the system is available for the doctor. The other part is worked upon by the clinicians themselves. So that goes on to prove that, when I say clinical clinicians themselves, I'm talking about the clinical administration team of my organization. They are piloting, they are coming forward, saying that we will give you a group of doctors from various age groups who will work with you to perfect a solution. So the uptake from the apex level of clinical administration is 100%. But when it comes to ground and the, if I had to give some percentage, it will be around 45 to 48%, but it is going up slowly and slowly. So that's where we are.
Fantastic, Sudeep. I hope people have made note some of this, how clinical adoption can be increased. And did you say chronic disease in context of the EMR, that your previous
Yes,
EMR had a chronic disease? That's
yes, yes,
fantastic.
yes,
As such,
yes.
they do have
Yeah.
chronic disease from that perspective. Let's move on. And I want to come back to Saji again. Saji, actually, you'll agree with me that Gen AI is no more in the pilot phase, and basically we are, actually seeing some real deployments, in this space, right? And I want to basically, see, and in this we are seeing, basically, improvements from documentation to, analyzing radiology reports or even patient engagement as such. So I wanted to understand from you, have you dabbled with it, experimented with it? Have you had some successes in this? And, from the, if you have, what have been your, surprises, good outcomes, and maybe the challenges that you might have faced in doing this? Saji?
Smith, as you know, we were again one of the pioneers in experimenting with the Gen AI. Luckily, I have a
Yes.
clinician in my team who is also equally an AI ML expert. So we were piloting a couple of use cases. So we initially targeted at the nursing colleagues, so that we could see in terms of the number, the benefit realization is much higher. So we used for multiple purposes, and we have seen the benefit also. It's in terms of generating a nursing care plan. You just provide the symptom and diagnosis, and it will create a beautiful plan which can get into the EMR, and later you can capture all your observations and outcome from that one. And also we have used in nursing education in terms of improving the individual nurses' communication capability. This is Gen AI work in the backing behind. It is more like a tutor with the different personas. The individual nurse will be interacting, and that will help them to improve. The Gen AI work as a tutor to highlight where they need making improvement. So we have done that one. So that also helped the nurses improve. And also we created multiple documentations, what we call the quick reference kits for the nurses, which are for in terms of when they do certain procedures or preparing patients for surgical procedures or lab investigation, medications. All these areas we highlighted that, and we found it to be very successful in terms of saving time, and also because the nurses, if you look at, they spend a considerable amount of their time on administrative tasks rather than focusing on the care. They are expected to provide compassionate care and show empathetic treatment to the patients, whereas in reality they spend. So we were able to reduce some of their burdens by bringing in Gen I use cases, and which want to be like a hit among the nurses. And also we implemented some solutions for auto dialing the doctors, and that is not Gen I but the NLP. Other cases, it's rather than nurse dialing, so system will dial and connect the doctor for a cross consultation or a primary consultation. So we have implemented in, and also we have recently implemented in the patient engagement. We have chatbot powered by GenAI kind of query handling and CRM solutions. So we have seen that, and now it is getting into mainstream. So as we all, Sudeep also highlighted, so we have now AMPI and DMR coming into mainstream.
Yeah, Aarti.
With the AMPI and DMR,
Yes,
there is
Aarti. I can hear.
a good use case of Gen AI. So there, the doctor will be dictating from the dictation to using NLP. It will be captured. It will be a, and then a beautiful medical record will be formed, and
Really?
relevant questions will be prompted to the doctor, and the conversation between a patient and then the doctor will become, and part of that conversation, the entire medical record will get recorded or documented, and the doctor can review and save assess structured data into the EMR. So we were blamed. I mean, as you all know, we were all blamed for introducing technology for taking away that natural interaction with the patients. So the doctors were saying most of the time we were looking at the screen, we didn't have the opportunity to look at the face of the patient. So now the technology itself is going to solve that problem. So we will be giving that facility using the new Gen AI capability. We will be able to, so the natural interaction with the patient will happen in that due course. The entire medical record will get documented. So that is what we are going to see in the coming years. So it's from experiment, it is coming to the mainstream, and definitely we will see the benefit out of it is in multiple, in clinical decision support, in administration, operational efficiency, patient engagement, providing better experience, and we are moving to more agentic AI. There, a lot of things will get autonomous, and the agentic AI will be performing certain tasks autonomously. So that is what we are going to see the revolution happening.
Fantastic. For people like you and rest of those who are with me today, I'll just simply say resistance is futile because outcome is almost guaranteed. So well done, Saji. And so, we heard the perspective from, a person who's leading Gen AI at a, tertiary care healthcare hospital kind of a situation. Let's just take the same kind of a question to Miss Pooja, who's, of course, as I mentioned, at CIO at OnQuest Laboratories. And, I think, that Gen AI has a lot of potential in, reading through lab reports, radiology reports, and so on. Maybe that will improve, the quality of what is coming out. Maybe it will improve the TATs. It will probably make sure that, the things are better. Of course, data will come out in a data form, not just, scan form, and so on and so forth, right? So I would just simply ask you in a couple of questions your, experience, if you have led this through as well. From readiness perspective, what was very important for you to basically, get these AI tools to support you, Pooja?
Yeah, good evening, everyone, and thank you, DHN, to have me over here. So, if I talk about AI basically in the laboratory system, so if we see across globally across how it is going through the lab systems, is that it is increasing using for the purpose of medical analyzing medical images for suggesting findings, and it is also assisting the clinicians basically rather than having an independent diagnose. So that is the kind of studies that are coming up wherein they are maintaining their clinical accuracy, I would suggest, and they're also indicating uh, I would say real evidence backed benefit that we can have from this. So, and if I talk about our industry itself or our OnQuest itself, so adoption basically where it is growing is it is more towards the workflow automation. That is one part that we are trying to do is then it is through integrations that we are having, the validations challenges which were there. So therein where we are trying to explore more, and especially it is like what I have seen is it is more related to standardizing the terminology. If you talk about we have cap, we have NABL aligned, so surely AI would help us in standardizing these terminologies, and we've also used it for like auto populating of clinical history, test methodology, reference ranges. So these are the kind of examples where we are trying to use this more, wherein our the value for this would be that there would be somewhere around 20% reduction in the reporting timing. That is what has been observed. We have
Right.
improved report consistency, that has been there, and surely it improves the tat. So productive tat alerts are there. We are using our BI as well, also for the tat alerts which are being sent on daily basis, and through this, so basically what we are trying is more predictive delivery timings, and surely this is helping us in improving the clinician as well as the patient satisfaction. Because if I talk about onquest is more into B2B. So for us, the clients which are giving us, especially the hospitals, the clinicians, so they matter similar to us as it is like a patient. So this is helping us in improving the CSAT, I would say. And again, we are also using it for critical alerts. So faster critical alerts can be taken, more faster the action can be taken on that, and the reporting can be done. So that is the kind of thing. And if I talk about what is the readiness, surely readiness depends upon, for any lab it depends on the limbs is the first thing. So if your limbs is structured, it is not I would say free text heavy kind of limbs, it has structured fields, it is easier to actually start the AI journey. That is one thing. Second, standardized test codes, nomenclatures, reference ranges. This is also some of the basic things that we need, that helps when we are implementing any of the AI pilots. And for so in this kind, if we talk about data digitization for limbs, surely onquest readiness level is high, I would say on that. Then again, it comes as integration and interoperability, that also helps. So AI tools, what I believe is they must integrate with your limbs, they must integrate with your reporting, your billing systems. That is critical, because therein, because where the most data is coming for any lab systems. So that is the kind of thing. And surely in this kind of thing, what for me a readiness indicator is, if your limbs as well as the other tool has the middleware availability, it has the APIs, HL7 integrations available, so that can help. And the last, or the most critical thing is the governance, security, and compliance point. So, and again, for DPDPA readiness work, so everybody is working on same. And again, OnQuest is also working on same. So this is one of the critical things that we would be working for this year. And in our limbs itself, we have role-based access, audit trails, which again is somewhat a high indicator for any of the Gen AI applications, I would say.
Okay, wonderful. Keep pushing the envelope. And next time we talk, probably you'll give us better stats in terms of how much percent improvement you've had. And we hope that other players in the space, are also challenged by you. I think there is a question, and maybe we can just throw it out there, and we'll come back again. And let's keep it a little brief. I think the question that is there is from Mr. Unmesh, if I don't read, if I read it correctly, how do you verify the AI algorithms for consistency and reliability? And this question need not be just for Pooja, but anybody can come in. But I would like to keep it brief because I want to cover a lot more base. Anyone? I believe it is suggesting that Pooja, you take the question. Should I read the question again?
Yeah,
Like, how do
you
you
can you just, I just missed that.
Okay, okay. Basically, what he is asking is that what the with the AI algorithm that you may be using, how do you ensure there is consistency as well as reliability? Two things that are very important, isn't it? Right? I mean, they need to be consistently providing expected outcomes, and obviously they have to be reliable. So that's the question that Umesh is asking.
Right. So basic first thing is that for any AI, you need to have a data to analyze on. So that is the first thing. And if I was right now talking about how we are ready to implement any of the AI tools, wherein surely as we don't have much of in-house development team, we are more with the vendors which are SaaS based. So our integration, our expertise more lies towards our limbs as well as the other applications which are more related to SFA or CRMs or business applications, I would say. So when we have to go for any AI integration, surely we go through all the parameters where the indicators that the any of the, I would say, startup or any of the company is bringing with, and then step by step we go through the algorithm. Or because first thing you need is, for any of the lab based applications, you need the expertise to understand if it is coming from maybe the molecular department, or if it is for the histo department, you need to have the person concern wherein the algorithm can be built with the expertise of that person. So that step by step is needed. If I talk about customer care engagement or patient satisfaction, surely we need to have the inputs from the department which is at the CRM head or the marketing people, wherein who give us the observation. So basis that the algorithms are built, and then internally we test the solution use cases. We try to test as many as use cases before making any of the application live. But yes, currently we have just worked on small applications like chatbots, not on the major applications as such.
Fantastic. And this question I'll ask, and we will, move to the next question after this. Should we be using, WhatsApp? I mean, just paraphrasing, okay, to share reports and stuff like that, okay. When we look at from the compliance lens, and I did not, but let's just take somebody else answer. It need not be, for Pooja. Let's hear from somebody else. Are you using WhatsApp, and is that really a good platform, knowing that DPDP is here and so on and so forth? Compliance
Yeah.
is another thing.
From a compliance perspective, if you look at WhatsApp as an end-to-end, it is an encrypted channel, and you
Yes.
are when you password, so it's protect through a password. So that is what, if you look at even the financial services industry is also using WhatsApp-based chatbots for interactions with the, I mean, the airline. All of them are using the same way for delivering. What is the difference for healthcare? So we can also deliver the same. It is very convenient for the customers, because especially for the elders and all, they are all used to WhatsApp. I mean, we are all in technology space. We know previously we used to send messages, SMS were the case. Now if you send SMS, nobody is bothered to look at. It's all WhatsApp. So that is becoming a or similar kind of a platform is become more of interactive in nature. So at this being in its nature, end-to-end encrypted, the channels are encrypted, and your content also, if you protect and share to them, and even otherwise also, if you have a portal, what you do, okay, you make the lab report available to the portal, and the report when downloaded, it will be again a password protected. So the same
Yeah.
way
Fantastic.
that can be leveraged. Why not?
Fantastic. Wise man has spoken. Channel is encrypted. Protect it with a password, and you can go ahead, I guess. So I'll just move on. And Manish, if your audio video problems is solved, can I come back to you?
Yes, please. I'm so sorry.
No worries. It can happen to anyone. And so, Manish, basically, what I was trying to get you at the start of this session was, see, you have a, I mean, you in some sense we envy you. You have a something you can build up from scratch. You have now no legacy to worry about, right? And so many things are coming into play, right? We grapple with so many things that are legacy, so many things that cloud or hybrid, so many stuff like that, right? So then, when you're starting afresh, right, you have a way to architect the entire ecosystem. And so then when you look at from, the interoperability perspective, going for ABDM, going for NABH, certification, for digital standards and so on and so forth, right? What's your approach so that you basically make yourself future ready right from scratch?
Yeah. Thank you so much. Hope you can hear me. So it's always double sword. We can
There
in
is
this
a
way that
little
while you have something, you may
Manish,
have
is
a baseline architecture or baseline regulatory compliance or baseline progress in your digital journey. However, when you are starting as a greenfield project like us, we need to not only just think about what we need today, we need to think about how things will evolve next 10 years to 20 years in terms of your business, in terms of your operational excellence, in terms of clinical outcome. So looking on the into in the enterprise is one thing is important that we need to factor in, and that's what we need to think through. One. Second thing is that once we have a clinical outcome defined, operational excellence defined, financial parameters are defined, it is important for us to think the design-centric mindset. And when I said design-centric mindset means we need to have some, overarching framework, as well as we are putting across how the human centricity comes in. Keeping in mind that India has, or healthcare has challenges like affordability and accessibility. So keeping these all the parameters in your mind and define a well-defined KPI, and then see that in 10 years' time how your ecosystem partners are evolving, be it a medtech, be it an application layer, be it a digital layer, be it a infra layer, be it a network or cybersecurity. So keeping moving elements from your ecosystem partner, having a strong digital framework and having a design principle in place, it will help you to evolve your design and architecture over the period of time. And that's what we are doing here. And the way we are thinking that it should not be just for the treatment. Can I have an end-to-end canvas in the mind where people will have a first healthy living, and then healthy living will lead them to the prevention. And if the preventions are happening, do we have a way to do the diagnostic? And if the diagnostics are giving you some biomarker to go for treatment, let people come in the healthcare facilities. And then you may need a home care because many times people go back for rehabilitation and so on, right? So keeping these 4-5 end-to-end mindset, you have into greenfield approach, not only just to start from inside the campus of hospital, we need to think beyond the hospital and how we can design 360-degree continuum of care. So that's where we are getting advantage. Of course, regulatories are there. Some regulatory parameters are defined today. We are also keeping in mind how the regulatory frameworks may change over the period of time, right? As we have a beautiful question where how we can share report over the WhatsApp, right? So these are the various channels, so-called system of engagement, system of interaction, system of record. These all will evolve over a period of time. So having said, Sumitji, it is important that we need to not only to factor today's ask, we need to also keep in mind how in 5 years, 10 years of digital hospital will look like, right? Not only it can happen within the campus, how it can happen beyond the campus. Hospital beyond the wall, right? We don't need to design something just specific to the given location. It can be anywhere, any place, and so on. So these are some of the design elements we are keeping in a framework in our mind and making sure that we are designing something for the futuristic way, so that the technology can be adopted, functional things can be adopted well in advance, and overall, very important, the experience of the patient or patient centricity is at the center. And when we say patient centricity at the center, we are also making sure that doctors, nurses, caregivers, or families and all are thinking loud and making sure that they also have a similar experience the way any patient will have the experiences, right? So keeping in mind the experience at the center, having a design and having a framework helps everybody to do that. Yeah.
Fantastic, Manish. It takes me back nearly 13, 14, 15 years ago when I also was fortunate enough to actually my new entry into healthcare plus into new, greenfield stuff. And looking back, I mean, so many things are still functioning as designed, because it was designed from scratch. My best wishes to you, of course, that you do, and we'll definitely connect back to you. And next time it's just Sumit, otherwise will be Manish ji. And I will go back to Lakshman Sharma now from Sarvodaya. And I want to ask Lakshman, you're there with us, right? Lakshman, if you are there, I want to ask you a question. Okay, I will skip Lakshman for a moment, right? And we'll go to Sudeep. Maybe we'll take this question of Lakshman to somebody else, right? Sudeep, Aster operates at so many different geographies, right? Probably you have a complex digital setup also, whatnot, right? We know that for AI to work well, and analytics to perform, perhaps cloud is essential. And but we know that we live probably today very much in in a hybrid environment, and then we have a lot of complexities with regards to vendor and so on. So what I wanted to ask you, Sudeep, was this: like, what's your actually cloud strategy today, right? Are you going or trying to get on full cloud, or you'll maintain hybrid or something else that maybe, case to case basis? And then related to that, right, some of the DPDP rules have also come in. And so what I want to understand from you is that given this kind of a structure, what is the governance, strategy and the challenges that you may be facing, Sudeep?
Again, a very interesting question, Mr. Sumit. And we have learnt it during phases, sometimes to discovery, sometimes by observing my colleagues like the ones who are there on the call. What we have felt is that, of course, sometimes it is inevitable, and I have three situations to tell you. One, when my load is predictable. So I generally use more predictable areas where costs are not impacted. So I go for either co-hosting or on-prem kind of solutions, uh, where it is quite predictable. But when it is elastic, that time I prefer to go for a solution which can give me complete visibility. So these are in the business and of course in the clinical solutions also, where of course we don't have a choice and we perforce have to go by the best of breed is when we are tied to OEM. For example, in my past work life and in the current one, we do treatment planning of patients who are on the remote site. So this treatment, the images are taken up and they are sent over to the cloud, and there is, and even for that matter in genomics, I was talking about radiation therapy earlier. So these images are studied there. These slides of genes are studied there. They are matched with the trends which are there in the. So these are in specific clouds. So those areas we have chosen to use probably an AWS. I don't want to name the OEMs here at the moment, but that is the choice we have made. But whenever the technology has been in our parlance, then for predictable load, I will go for areas where I have more control over costs, and FinOps are very important. Where I have elasticity requirement, then I go for clouds which give me a lot of visibility, and I know when my load is going up, when my load is coming down, so that I can calibrate and use it more effectively. Now, coming to what becomes challenging, one second, sorry. What becomes challenging in under such circumstances is, and you are absolutely right, sir, that it becomes complex as we grow with systems. More and more systems come into play. We need to make sure that all these
Sudeep, are you there with us? We seem to have lost you momentarily. Maybe Sudeep is having some challenges. When he comes back, I'll ask him to continue. And uh, I want to ask a question related to cybersecurity and its governance. And earlier I was thinking, maybe I'll ask Lakshman, but Saji, can I ask you something related to cybersecurity and governance, if you may?
Sure. Yeah,
So,
sure.
cybersecurity, of course, in this current year, okay, has taken a very, center stage, of course, because of the threat landscape and so on and so forth. So I wanted to ask, okay, has it become a boardroom discussion yet at your place? And also, like, are there some specific measures that you may have taken, for example, like, VAPT, encryption, audit logs, breach, protocols related, things like that that you might have implemented, and so on. And among this particular set, or maybe be outside also, what is your thought has been the hardest piece?
Uh, Sumit, it has taken center stage of recently for the reasons. One is the DPDPA. So the DPDPA implementation requires certain the security measures to be put in place. So the IT security measures to in terms of implementation, and also even otherwise also with the, as you said, with the changing threat landscape and the damage it is bringing to the enterprises, just taken definitely as understand. And along with that one, there are compliance requirement also. When your statutory auditors come over part of your MCA complaint and all, you need to have proper audit log in places, and you need to have proper access control in places, and your identity and access management become, you need to go for multi-factor authentication, and NABH also now gives credit for your single sign on, and many other areas. And also it's you need to look at your traditionally we were talking about VPN access. Now we are talking about is it so many other things are now changing. In one is the threat landscape is changing, and the solution which are available also it's more AI driven threat intelligence is now coming into play, and you can centralization. You need to have a SOC or extended SOC XDA, or so many things are now coming into play. So it is so the enterprises are now looking at like you in the past you had an enterprise architecture for your business application. Now you look at your enterprise security architecture also, which covers your the operating environment and your external environment, and then your technology landscape, and you come up with a strategy which will address both your IT security and data privacy needs. So that is how the organization started looking at, especially the enterprises started looking at cybersecurity and data privacy. And it is definitely, and you could see that one because of the huge penalty associated with privacy violations. So the board and you get the record support from the board, because the penalty amounts that we are talking in the range of 250 crore. So when, and if we need to go for a cyber insurance also, the premiums are very high, and the insurance companies will definitely look at what are the safeguards, your guardrails, and based on the premium may go up or down. So this has definitely taken to the boardroom, and you are getting support. So now the challenge in that one is outside talent. You don't have the right talent understanding the entire IT security landscape, and so that is the attracting the right talent and identifying the right solution. You don't have a one shop for all your security, IT security needs. So finding out the right solution, having the right talent, that has become a challenge now.
Right talent is so necessary to run the department well. There was a question that flashed briefly for Manish. So let's just see that question, which is, you mentioned being prepared or anticipating regulatory changes. Could you elaborate on how, as an organization, we could be prepared of or basically of organization trend to play catch up? Okay, Manish, I request you, in the interest of time, to keep it a little brief. I know you can shed a lot more light on it, but let's just keep it brief.
Here, our future lies here. We have a two type of data for the regulatories. One is a structured data, second is unstructured data. So far, we have been more focusing on a structured data. Hence, sometimes we are capturing in a structured manner information, and the regulatories are either defining your ask and you are not catching up because you are build up your system in terms of digitization and digital in terms of a structured way of doing. And hence, you have a structured data. So to evolve with the regulatory compliances, it may be something may come in the future. Am I ready to go with that? So the one of the approach we see is that the real-time enterprise-wide building up the data intelligence. And that data intelligence is not only just designed on a structured way of doing, also it could be covered up your on a structured way of capturing. I mean to say that here, whatever you want to sense during the continuum of care, just sense it. Means you collect it. It could be a structured or unstructured way of doing, right? And then analyze it continuously, and therefore you decide upon whether you need for regulatory purpose or you need for operational purpose or you need for clinical purpose, and then act it. And the future will lies in this way is that how these all can be orchestrated with the help of your automated intelligence, and so-called we call it as the AI way of doing things. So as long as we have a structured and unstructured both data getting sensed, analyze, decide, and act, hope so we will be able to evolve along with the regulatory need and so on. That's what we see in the future.
Fantastic, Manish. And there's another question, probably coming your way only, maybe, right? And this answer has to be like a rapid fire answer only, because I need to cover a few more bases. And what he is trying to ask, or Manish, I can't read the name properly. How do you balance innovation speed with regulatory preparedness? And others can also opine, but Manish, will you take this in briefly? How do you basically, balance that? We are not able to hear you, Manish. You are on mute right now. I can see your microphone being on mute.
Can you hear me?
Yeah. Yes.
Yeah. So innovations are our everyday activity, right? And our healthcare industry is catching up slow. We are very slow mover, and we are the last leg because we have to ensure that we have a patient outcome or experience outcome in place, right? Innovation is the part and parcel. It will omnipresent in the future, and the way we see that, looking on the quantum computing, looking on the way speech is coming up. So these all collectively will help to ensure that innovation remain with the regulatory, because it is not a afterthought. It will remain in the journey. So hence I see that innovation will drive in parallel with the regulatory demand. And as I said, that on the structured data, where you have a voice and picture all coming together. Hope I can answer this one later on too in detail in case needed. But
Sure.
keep in mind that these all will go hand in hand, real time, real time way of thinking, where we are not just building a digitization, we are building a decision intelligence, and that decision intelligence will drive your regulatory need as well.
Sure. So,
Hope I answered.
some of our guests have a hard stop also. So I'll just keep moving. Maybe the questions we'll take it towards the end of it, so that we can address them all. And I want to come to Pooja, and this is a two-parter. Firstly, you mentioned that, of course, you are a B2B. And so how are your other partners, basically the hospitals, negotiating in the context of DPDP? And what I would like to also ask is that, ABDM, has this health data exchange, right? How are you enabling that, in a more, for adoption, not just from the hospital, but also to be appreciated by the patient? So quickly, Pooja, if I may.
Yeah, so if I talk
Yes.
about ABDM, I'll just take the ABDM part first, because we just did it with one of our government projects wherein the integration was necessary. So ABDM became one of the critical parts for us, and we did this integration with our LIS, and I clearly understand. So what were the issues, what we faced, and what are actually the benefits that we have if this data is integrated. So in one of our government project, what we found was that while doing the ABDM integrations, see, it involved first step, it involves is ABHA verification, which is patient consent driven verification. Second part they involve in the integration is related to the report generation in ABDM, which is in the compliant forms, which have already been defined, and basis that the integration is being done. And then there are the APIs for data, which is wherein the push and pull happens between the ABDM gateways as well as the LIS gateways, or I'm sure HIS gateways would also be working in a similar manner. So the now most of the effort that lies in this integration is actually mapping the LIMS data to the ABDM schemas. The kind of complexity that we have over there, that mapping itself takes a lot of time, and then handling that partially, or I would say sometimes it's a failed patient flows which happens, and it impacts operationally a lot. Now what once the integration is done, still the problems that we face with this kind of integration is front desk staff, if he or she is not using it, they are not explained well about the ABHA integration, they'll just skip it. There are lot of, I would say, still there are a lot of lacunas in the integration, wherein the skipping of what happens is, even if it is integrated, your LI system is integrated, like we were discussing with our projects person as well, that even if it is integrated 100%, still what we face is that 10 to 15% of the data is still not getting integrated through the systems, because the person who's the registrating person, he's just skipping it, because the possibilities are already there which needs to be taken care of. And I believe is, if this adoption happens, it comes with a clear message that if you have this adoption, what are the benefits that you are going to have it, because it's a very good system, I would say, the kind of integration that has been done, because one device you have your data from any of the lab reports, like we deal in lab, so you have lab reports from any of the sources when and where you did. So that kind of thing, but the clear message is not going through, which is actually some of the gaps, I would say, the tools that are not actually, or it's not being propagated to the people with the clear messages that all reports in one place is actually the integration reason why it is being done. And similarly, the steps during this ABA integration, I would surely state that there should be seamlessly less steps as compared to what we are doing. And in case the labs, if they are not even ready, they are on the legacy limbs. So it becomes very complex with the labs to get into such kind of integrations. Now you asked about what would be the business values for the labs, of the ABDM for the labs. So surely it gives better, or I would say, audit and traceability. It gives compliance with the national healthcare systems, which is surely required. And going forward, it is easier to integrate with other systems also, like insurers, corporate health system programs, or any of the telemedicine programs. So such kind of things. That is. I would say that could be one of the things that can be there. And the last part, I would say, the ABDM going forward, if it was competitive advantage or it is related to compliance, as you just mentioned. So if your limbs is structured and standardized, surely it's a competitive advantage. But in case it is a legacy system, then it becomes a compliance burden for the labs. And manual workaround are available as of now, so getting 100% people available on that also becomes a problem. So
Okay.
that is my take
Okay.
on this.
Thank you, Pooja. And Saji, if I can come back to you, okay. CFOs are not that easy to convince. They want to know ROI. They want to, get very, distinct answers on what to invest, right? So, when you speak to them, what is it, some investment you will fight till the last breath that they actually basically, fund it, right? And maybe something that, you are willing to give up or basically say, okay, we can always do later.
Definitely, the CFOs will look for return on investment. So we need to build a proper business case before we take it up to CFOs or for the board, for that matter, for getting investment approved. Some of the initiatives at our hospital now happening is we are consolidating and acquisition going on. So getting without much struggle, I'm getting the required financial support to bring all the hospitals into a common platform, be it for the back end or the middle layer or the front layer. So some of the things are complaints in nature. DPDP, you don't have a choice. You have to comply with one. Definitely, you get the required support from the board and CFOs. That's not an issue. At this point in time, I don't see much challenges. But when you wanted to certain things, like when you wanted to, that is where one of the question also, when you wanted to innovate versus balance between compliances, yes, for some of the innovative approaches that you bring to the table, so definitely people will be looking for a return on investment. So that is where an in-house team also will help me. So it's what we'll do is many of our innovations are mostly is incremental in nature. So we'll do it in a small pilot basis, show the benefits, and then say how we can roll it out to other units or other areas and show the return. So then it's easy. And also we get better buy-in from other stakeholders, especially from the clinicians also. So involve them early and get their buy-in. And when, especially for the hospitals, when clinicians agree to your solution, so they do buy-in, they are the revenue winners for the hospital. So it is easy to get CFO support also.
Fantastic. And, we are actually nearly out of time. And, I think 1 hour will be never enough. And I see a lot of questions pop up. Maybe we can get those questions, through DHN and we can answer them offline. Thank you very much for taking your time out of your busy schedule and commitment that you have provided. So I actually wish you all on your continued success and the endeavors that you have coming up in the year 2026. With that, I would like to close this session today, and my best wishes for the year end celebration and holidays as well. Have a wonderful time, and hope to see you and interact with you again soon. Take care. Wonderful evening to all of you. Thanks a lot.
Thank
Thank you
you.
so much. Thank you.
Everyone.
Thanks.